Welcome back to this follow-up video about Ozempic and Mounjaro. There's many new things that has happened since my last talk, and I will update you with that. The title of this now is The Truth About Mounjaro versus Ozempic, What They Are Not Telling You. Part 1. The hype, the reality, and what you need to know. If you've been anywhere near social media, you've probably seen the headlines. The new miracle weight loss drugs. Doctors warn about serious side effects. Pharmacies are running out. Should you be worried? It's a mix of excitement, panic, and a lot of confusion. I'm Dr. Ho from Australia. I'm a skin cancer physician, and I'm also interested in all things medicine. We are going to cut through the noise. We are going to break down how these medications actually work and why they have become so popular. What side effects people are really experiencing beyond the headlines, and what happens when you stop taking them, because that's a conversation that not enough people are having. But stay with me, because in part 2, we'll tackle the biggest misconceptions, the debates over long-term effects, and what the research is actually saying. So what's the deal with these medications? Let's start with the facts. Mounjaro, tirzepatide, and Ozempic semaglutide were originally developed to treat type 2 diabetes. But because they help regulate blood sugar and curb appetite like nothing we've seen before, they quickly gained attention for weight loss. And when I say they gained attention, I mean demand rocketed. And when I say rocketed, I mean to the point of shortages, underground markets, and government crackdowns. In Australia, authorities had to step in to shut down illegal sales after reports of serious side effects from fake or compounded versions. Some people ended up in the hospital. In the US, diabetics rely on Ozempic for their health are struggling to get their prescriptions because so many people are using it for weight loss. And in Europe, regulators recently investigated whether these drugs might be linked to mental health effects. No conclusive findings so far, but the fact that they have launched an investigation shows how closely these medications are being monitored. And what about the side effects? It's true that some doctors have raised concerns, but it's important to separate reality from online fear-mongering. The most common side effects: nausea, diarrhea, constipation, and fatigue. These usually lessen over time, but for some they can be severe. In rare cases, people have reported pancreatitis, gallbladder issues, and even muscle loss. Of course, all these has sparked debate over whether these medications are truly safe for long-term use. So, are the doctors alarmed? The media is certainly excited about it. No, not exactly, but many do caution that these drugs aren't magic pills. They require medical supervision, lifestyle changes, and careful monitoring. And then there's the elephant in the room. These drugs work, but only while you're on them. Forums, social media, and even clinical studies all suggest once people stop taking these medications, many regain a significant portion of the weight they lost. Why? Because these drugs don't cure obesity, they help manage it. This raises a huge question. Are people signing up for lifelong medication without realizing it? Which brings us to the big debate. Which is better, Mounjaro or Ozempic? Ozempic or Mounjaro? Some studies suggest Mounjaro leads to greater weight loss than Ozempic, but the full picture is still emerging. Factors like tolerability, cost, and personal response to medications all play a role, and doctors don't yet have a universal answer on which one is the best choice for everyone. In part 2, we'll dive into the most common myths surrounding these drugs, why some people believe pharmaceutical companies are not telling the whole truth, and what the leading researchers and the ones actually studying these medications are saying about their long-term effects. This is where things get really interesting. Trust me, you don't want to miss this. So let's go through to part 2 and let's go even deeper. Mounjaro, part 2. Myths, conspiracies, and what doctors aren't saying or are saying. Alright, check it out. Now let's get into the wild side of the whole Mounjaro versus Ozempic craze.